We continue, of course, to give you the very latest, and as we mark TB Day, we also get analysis from various professionals around this particular matter. We're now also joined via video link by Professor Nazir Ismail, and he is the head of the Department for Clinical Microbiology and Infectious Disease at Wits University. Prof, a very good afternoon to you. And thank you so much for your time. I want us then to speak about a number of things that are, facing TB in South Africa, particularly given just also the developments over the last few months in terms of much needed funding. Now that, some aids, including PEPFAR, are no longer something that we can rely on. What are some of the avenues then that South Africa can look at? I mean, Dr. Aaron Mazwaledi speaking there, saying that this probably gives South Africa that opportunity to start looking for much needed funding in this particular area. But how will this now impact, TB research, also just TB monitoring and tracking?
Thanks a lot, and good afternoon to your listeners, and thank you for the invitation. Yes, I think one thing very clear is that the challenge with TB has been a chronic problem in South Africa, particularly driven initially by HIV, but also other behavioral issues that have impacted on patient care seeking and also the services that are offered. So just to give some context, I mean, there's about 270,000 people estimated to be having TB annually. That number has reduced over time. So I think the one important lesson to be learned is that, we often talk of a budget. There's always money. It's about what it's allocated to and what it's used for. But I think the key take-home message would be that when you look at investments in TB over time, it's actually been one of the most positive and most effective investments, because in terms of return of investment, you really achieve successes. I remember about 10 years ago, we were about 400,000 TB cases annually, and now we're down to about close to 200,000, meaning that you're reducing that entire burden on the health system by doing what's needed to be done. In terms of external funding, I think, we've been, in South Africa, we've been relatively sheltered by good decisions by the Ministry of Health, in a sense that like our TB treatment, ARV treatments are largely paid for by government, essentially by taxpayers. So we pay for our own treatments, unlike many other African countries who are in a much difficult and much more troublesome situation. In terms of, the supplementary funding that's required, particularly around research, we know that the research has been a key driver in deciding what works and investing in that and making a big difference. So the thing is, we shouldn't also be blinkered by, only funding can come from the US. There are many other agencies in the UK, for example, we know Wellcome Trust and a few other important ones. There's, a Horizon 2025 and 35 in Europe that provides funding. But I think we should also be more wider in a lens of sort of the emerging markets. South Korea, whether it's China, Japan, there are many other countries that could also support research activities and also share a relative higher burden of TB relative to the US. So I think we should widen our horizons on one hand. The second, I think, and most important is also, I strongly believe that internal funding from within our treasury reserves, it's the South African problem that needs South African resources to address the problem. So I'd say we shouldn't also shirk our responsibility as a country.
But in the main, I think it's a positive message, that you are just conveying in terms of how well government has been able to work on that particular front. But when we start looking at, TB and its evolution, perhaps speak to us about, just what factors play a role here in effectively diagnosing, first of all, TB, and then secondly, treating it, TB. What are the challenges that you continue to see in that particular area? Right.
So I think we're blessed in South Africa. We've had an excellent implementation of new approaches. To be honest, I think if you had TB, you'd probably be better off in South Africa in terms of the biomedical solutions. So we have really state-of-the-art diagnostics. We have the best treatments, even for drug-resistant TB, and implemented at scale. With really the best researchers, scientists in the world. So I think if you had TB compared to having TB in the US versus being in South Africa, I'd say from a biomedical perspective, we definitely have what's needed. The underlying challenges has been around the delivery aspects and I think the behavioral aspect, which are quite challenging. So we face a problem of obviously catastrophic costs that affect individuals with TB. They're often in the poorer rungs of society, and that is an underlying problem. That's the one. The second is obviously the agency to reach care. The second issue relates to just general understanding of TB and the fear and the stigma that goes with it. And those are two sort of important barriers that we really need to overcome. It's interesting, we had done a study very recently, a randomized controlled trial, and we published it in the Lancet ID very recently. And what we did was we basically used digital recording systems, biometrics essentially, and we offered individuals that had come for testing for TB cash incentive. So each time they would come back for the result or come back for treatment, we'd give them 150 Rand digitally, and we'd also done pre and post test counseling for them. And we really showed a significant improvement overall in the successful outcome of patients and also reduced loss to follow-up. So we addressed some of the behavioral and financial issues through a very small stipend that allowed patients to sustain their time through care. So I think there's definitely initiatives, but we need to do a lot more in terms of patient education. And the need for early arrival at health facilities to get a diagnosis. As the Deputy President has indicated, like I said, we've got the best diagnostics and treatments available globally, and it's all free in the public sector. So I think it's just about changing behavior. That's really our problem now.
Yeah. And Prof, very quickly, we are fast running out of time, but just on that point of behavior, when you consider, of course, that we are told that half of those that have TB also are HIV positive, in terms of those incentives that you speak to, will this also help in the fight against HIV in terms of encouraging people, of course, that have tested positive to continue then taking their medication too?
Yes, so certainly, I mean, taking the ARVs are quite critical in essence, making sure that they don't sort of develop TB again. So that's one important thing. Obviously, taking TB treatment themselves is another. But I think those are just sort of where people have already arrived and are in care. The challenge is often people that have not arrived into care, and there's a big amount of stigma. And I think just to also allay any fears, essentially TB is a treatable and curable condition. Usually the therapy is 6 months. It's all oral nowadays. And, within a month, people usually feel much better, even within a few weeks. 6 months of treatment and you're cured. It's not like HIV or diabetes where it's lifelong therapy. So I think the whole mindset needs to change, and we've got really good treatments now where, I mean, the success rates are exceptionally good even for drug-resistant TB these days. So I'd say that we should really encourage people to sort of change their mindset. It's not like in the past. TB is a very curable and a disease that can be easily managed. And there's no fear in it. I mean, it's very common, as the minister had said. I mean, the number of people with TB, I mean, we know a lot of people in our families, among our friends, etc., that have TB. So it's not something to be afraid of. They've all had it. They've all cured of it, the majority. The ones that have not cured are often people that have delayed seeking care when it becomes very difficult when patients' health status has really worsened quite dramatically.